For follow-up, there was a 4-year restriction period, and it was also divided into periods to evaluate the different risks at different times. A user was censored if the specific antipsychotic they were using was stopped, or they initiated multiple antipsychotics or switched antipsychotics. Follow-up was ended with head injury, with either head injury, long-term hospitalization, institutionalization, death, antipsychotic users discontinuing their first use period, or at the end of the study period, essentially whatever came first. The most used antipsychotic, risperidone and quetiapine, were also compared at follow-up. For analysis, it seems that users use benzodiazepines, antidepressants significantly more frequently, as well as opioids were found to be slightly more commonly used compared to non-users. The most initiated antipsychotics, like I said, were risperidone and quetiapine. And as far as the use of other drugs in addition to antipsychotics was more common among Seroquel users, which would be significant for drugs regarding Parkinson's disease. All these changes were balanced via IPT weighting. For associations, antipsychotic users had a higher incidence of head injuries and a higher risk of TBIs. For both of these, the risk was strongest at initiation of the antipsychotic. And as far as TBI events, there were lower TBI events recorded with the data, so the hazard risk ratio was lower than head injuries. Quetiapine users also had a higher incidence of head injuries than risperidone users, and there were even stronger associations associated with or seen with TBIs.